The use of NSAIDs is very common, certainly. And with that said, one of the challenges oftentimes with NSAIDs is recognizing that patients can take these medications on their own over the counter. For example, naproxen, ibuprofen, these are available over the counter in the United States. These drugs work by inhibiting COX-1 and COX-2 cyclooxygenase. And by inhibiting these enzymes, that can result in a reduction in prostaglandins. Prostaglandins are important mediators in fever, inflammation, and pain. So NSAIDs, by inhibiting COX-1 and COX-2, decrease prostaglandins, which help reduce fever, help reduce inflammation, and help reduce pain. So you could imagine the circumstances in which these medications might be beneficial. So they can help bring down that fever. They can help manage inflammation in something like rheumatoid arthritis or a sprained ankle. And obviously they can help reduce pain in some of those situations as well. NSAIDs have a lot of side effects. GI bleeding is probably one of the most common side effects, or at least one of the more concerning side effects. Stomach upset can happen. It may progress to GI bleeding. As we get older, we need to worry about elderly patients a little bit more. We also need to worry about patients on anticoagulation, antiplatelet medications already that may be at higher risk of bleeding. And in patients where we can't get away from using an NSAID, we may use stomach protection. So examples, an H2 blocker or a PPI, like omeprazole, to help reduce the risk of GI bleeding and stomach upset. We can also take these medications, or we should take these medications with food. That can help with that stomach upset. Another side effect with NSAIDs is that they can potentially exacerbate CHF. So it can cause edema, swelling, or at least contribute to that. Kidney function is another thing that NSAIDs can impact in a negative manner. I think of patients on diuretics, on ACE inhibitors already, or that may be at risk due to other things as far as their kidney functions go. If you've got a patient that has chronic kidney disease already, and maybe their kidneys aren't functioning that well, NSAIDs definitely should be avoided if at all possible. Same thing with heart failure, and same thing with a patient with a history of stomach bleed. Do everything we can to avoid NSAIDs if possible. If you get to high enough doses, you may see NSAIDs contribute to resistant hypertension, so they can elevate blood pressure a little bit sometimes. Examples of NSAIDs include ibuprofen, which goes by the brand name of Advil or Motrin, naproxen, brand name naproxen or Aleve, aspirin. I'm going to talk about aspirin separately a little bit due to the nature of aspirin being utilized in post-MI and things like that. Diclofenac, Voltaren, etodolac, Lodine, indomethacin, Indocin, ketorolac, Toradol, meloxicam, Mobic, nabumetone, brand name Relafin, piroxicam, brand name Feldine, and Sulindac, brand name Clinaril. It is important to remember that on all NSAIDs, there is a boxed warning on fatal MI and stroke. The other boxed warning I kind of mentioned, the potential for GI bleed and ulceration. That risk of GI bleed and ulceration tends to be a little bit higher with certain NSAIDs. So, for example, indomethacin and ketorolac tend to have higher GI risk. With ketorolac, there actually is a boxed warning, and use is recommended for no longer than 5 days. Due to the antiplatelet nature of NSAIDs, they can increase risk of bleeding as well as, cause that direct insult to the GI tract, causing damage and pain that way. But due to the antiplatelet effect, we actually hold these medications usually before and after surgery. And this obviously needs to be monitored closely with the platelet function as well. We'll take a quick break from our sponsor here, then we're going to cover drug interactions and kinetics. Whether you're a nurse practitioner, nurse, pharmacist, pharmacy student, med student, meded101.com has a growing list of great resources to help with board exam preparation as well as becoming better at medication management and pharmacology. meded101.com/store is a fantastic resource you need to check out. Again, meded101.com/store, STORE. Drug interactions are something I deal with on a pretty regular basis as far as NSAIDs go. So the first thing I always think about is those antiplatelet and anticoagulant agents. NSAIDs, I mentioned, can inhibit the effect of platelets and potentially make patients bleed out more, bleed out quicker. So anyone with GI bleed concerns or bleeding concerns in general, and let's say they've had a heart attack and they're on aspirin and Plavix, let's say they have atrial fibrillation and on warfarin, or they have a blood clot like a DVT and are on enoxaparin or apixaban. Any agent that has those type of properties, if we throw an NSAID on top of that bleed risk is substantial. So that is definitely something we have to monitor closely. And if there are other alternatives, we generally try to avoid NSAIDs in the management of pain, fever, or any other condition that they might be helpful there. NSAIDs can interact with lithium and actually raise lithium concentrations. So that's kind of a unique drug interaction there as well. I mentioned the fact that that NSAIDs can contribute to kidney failure. And so patients already at high risk for kidney issues and on medications that can cause kidney problems, like diuretics, which can dehydrate a patient and potentially put them at more risk. ACE inhibitors as well, another class. ACE inhibitors, and you can pull in ARBs there as well. Those can cause some trouble with the kidney, and particularly when you throw NSAIDs on top of that, that may increase that risk even more. Now at the beginning there, I mentioned a lot of NSAIDs within the class, and there's plenty of kind of clinical quirks between the different agents. This is kind of a general overview, of course, but I did want to pull in two of the most commonly used NSAIDs, naproxen and ibuprofen, and just talk a little bit about half-life as far as pharmacokinetics go. So naproxen generally has a longer half-life than ibuprofen, and so we can dose naproxen less often, which for some patients can be a really nice thing, so they're not taking pills all day. For other patients that may have only a short period of time, or maybe they only have a certain time of day where they have more pain than others, a shorter acting agent might be useful as well. So ibuprofen, if you look up the dosing on that, it's dosed 3 to 4 times a day usually, and naproxen typically dosed twice a day. And that's simply due to the difference in kinetics and the difference in half-life as far as how long these drugs last in the body. Some special populations that I wanted to talk about NSAIDs in. I kind of hinted at the elderly. NSAIDs definitely in most situations being a little less safe than acetaminophen. Obviously, acetaminophen in liver failure or things like that definitely presents some risk. But generally, acetaminophen in the majority of cases is probably a little bit safer place to start. Ibuprofen, naproxen, NSAIDs are not used in pregnancy. That's an important thing to remember there. Pediatrics, we generally stick with ibuprofen. Dose is in the ballpark of 4 to 10 milligrams per kilogram per dose. So that's a good question. I've been asked before on different exams and things like that, so it's good to know the pediatric dosing. I mentioned I'm going to talk about aspirin specifically in an upcoming podcast due to its use as an antiplatelet agent to reduce the risk of heart attack, stroke, things of that nature. But I did want to mention that we absolutely avoid the use of aspirin in pediatrics due to the risk of Reye's syndrome. Reye's syndrome is a very rare, but it is a serious condition that can cause some issues with the liver as well as the brain. It can cause some swelling and things of that nature. So, again, very rare situation, but aspirin specifically can increase that risk. I think that sums up the NSAIDs today. Please feel free to reach out, reallifepharmacology.com. I've also got that free giveaway, a 100-question pharmacology exam where you can certainly test your skills for free. Thanks, everyone, and have a great day.